We're now going to demonstrate to you the hip abduction exercise in standing. The abductors are the muscles on the outer part of your hip. Now, the aim of this exercise is to strengthen these muscles. This can be really useful in conditions such as lateral hip pain, mechanical back pain, and generally lower limb conditions and injuries. Now, weakness to these outer hip muscles can lead to increased stresses and strains being placed on the joints and soft tissues of your back, your hip, and your knee. This can ultimately lead to pain. You may find it difficult to perform simple daily tasks like walking without a limp, standing from a seated position, or climbing stairs. It's really important that you strengthen this area because stronger hip abductor muscles are more effective at supporting the joints and soft tissues, and this can ultimately lead to a reduction in pain. Okay, it's really important that we get the right technique with this exercise, and that's what we're going to talk about now. So Pete, if you like to face the wall, and what I'd like you to do, Pete, is contract both buttock muscles, so squeeze that together, and take your affected leg out to the side. It's important that you keep your back straight while doing this. You should feel this muscle working on the outer part of your hip. Yeah. Good. It's really important that you feel this muscle working. One of the biggest faults with this exercise is actually overusing your back muscles and hitching at the hip. This is generally due to a weakness in these abductor muscles. If this is the case, you may want to refer to our easier hip abduction exercises, like the abduction exercise in side lying or even the bridge exercise. Another reason for this is poor core activation. Again, you might want to refer to our core activation exercises. Now, if you're unable to correct these techniques with these tips, then you really should consult your physiotherapist. We recommend that you aim to build up gradually to 30 repetitions, holding for 5 seconds each time. Make sure you take regular breaks when you feel you need to. Alternatively, listen to the instructions given to you by your physiotherapist. Now Pete, it's normal to feel muscle ache around this area, but what we don't want is for that to increase your pain by more than 2 out of 10, with 0 being no pain and 10 being the worst pain imaginable.